So let's take a look at what you would experience if you were to come in and have a balloon sinus dilation procedure performed. First, let's take a look at the sinuses. The sinuses are these air-filled spaces above the forehead, between the eyes, and underneath the cheekbones. And from each of those sinuses is what we call an outflow tract, or a passageway that leads from the sinuses into the nose. When the sinuses are functioning well, they're able to ventilate and drain, and people do not have sinus pressure, sinus headaches, abnormal drainage, sore throats, and the usual symptoms that accompany sinusitis. But when these passageways are narrow or blocked, that leads to the buildup of infection, congestion, and the symptoms that go along with sinus disease. When you have a balloon sinus dilation procedure, you'll come into my office. You'll be seated in a regular treatment chair. I'm going to numb up your nose with different types of medication to make you comfortable during the procedure. And then with a monitor right next to me, I'm able to use a special device that allows me to go into the nose, and I'm doing this under what's called navigation, where I'm able to see where the tip of my instrument is, where the wire that comes out of the tip of the instrument, much like an angioplasty, opens up blood vessels, and thread the balloon over the wire into the sinus. And then I inflate the balloon, which opens up the sinus, creating a wider opening from the sinus into the nose, and from the nose into the sinus. And after the procedure, my patients go home requiring just Tylenol or Advil for a couple of days. There's no packing, there's minimal drainage, there's minimal bleeding. My patients are going back to their normal activities 2 days after the procedure, and about 2 weeks following the procedure, everything is pretty much healed. The beautiful thing about this procedure is that it has a 96% success rate of improving sinus problems, a significant decrease in the number of medications that need to be used for sinus issues. It's covered by insurance, it's safe, and minimally invasive. I think it could be a great procedure for you if your sinus problems are not being treated effectively with medication. And I look forward to helping you feel better.